Hi, I'm Dr. Sheikh and this is Dr. Ortner. We're from the Department of Anesthesiology at Stanford University. This is Dr. Didi Goodnow, our standardized patient. Welcome to the SOAP POCUS video series. Today we're going to cover point-of-care lung ultrasound in the pregnant patient. For more details on image acquisition and image interpretation, please refer to the other videos on pleural effusion, pneumothorax, and the clinical decision tree analysis. In general, the lung ultrasound exam is similar in a pregnant patient as it is to a non-pregnant patient. The areas to be scanned depend on the clinical situation and the diagnostic aim. There are 8 regions that are usually scanned, which are marked on the following image. In the evaluation of interstitial syndrome, 3 other methods have been described. The 12-region technique, including 2 lung regions on each side of the patient's back, the more rapid 4-region technique, sufficient in some acute scenarios and assessing only 2 lung regions per patient's side, and finally, the most comprehensive technique is the evaluation of all 28 rib interspaces. In the pregnant patient, particularly near term, anatomic changes due to pregnancy have to be considered. The gravid uterus might cause significant cephalad displacement of the diaphragm. Scanning lung regions on the left hemithorax might be challenging due to the displaced heart being closer to the chest wall. As you can see, the ultrasound probe must be placed higher than usual on the pregnant patient's chest. This anatomic change in pregnancy does, however, favor our image acquisition in transthoracic cardiac ultrasound. When performing a lung ultrasound, the patient is scanned in the semi-recumbent position. Always remember the effect of gravity when performing a pulmonary ultrasound. As air goes up, a pneumothorax will best be identified in the cephalad lung regions. In contrast, pleural effusion or interstitial pulmonary edema will be best appreciated in the lower-lying basal lung regions. Choosing the right ultrasound probe depends on patient's anatomy and the diagnostic aim. For assessment of pneumothorax, the linear probe may have the best resolution to identify lung sliding. For assessment of pulmonary edema and lung tissue, a probe with higher tissue penetration might be preferred. This includes a curved array probe or a phased array probe. Let's start with a linear probe. This allows best visualization of the presence or absence of lung sliding. Now let's compare the images when using a curved array probe. As can be seen on this image, this might allow deeper tissue penetration. Another advantage is that lung tissue under several adjacent rib interspaces can be visualized. Images using a phased array probe look very similar, but probe placement in between the ribs might be easier, and as a further advantage, the ultrasound exam can also be combined with a transthoracic cardiac ultrasound. In summary, lung ultrasound image interpretation is similar to the non-pregnant individual, but it has to be considered that the diaphragm is displaced cephalad by the gravid uterus. Use your probe depending on the patient's habitus and diagnostic aim of your exam. Look for lung sliding, A and B lines, pleural effusions, and lung consolidation. Combining a lung ultrasound exam with transthoracic echocardiography can be complementary. Please see our video on the clinical decision tree analysis for more details. Thank you for watching.